So what are you doing lah?
Hi sir. Sir, I think the building has got some flaws in the designs. It's not Ratta.
You're an engineer,
Sir, only sir, this.
Hey, isn't that
Sir, this is
my scoliometer?
I mean, but isn't it for the buildings? Used for the buildings?
Yeah, the masons use it to build. So you're wondering if it's for the building, what it's being used for?
Yeah, exactly.
Like, weren't you designed by the cosmic architect also? Vishwakarma.
Something to think
Ponder. So we look at scoliosis examination, a brief one, because this is mostly a postgraduate concern. But let's see what you can do at an undergraduate level. So as you always know, it's always look, feel, move, special test. In look, if the gait is possible, you always test for a gait. So as usual, you test for a gait, ask the patient to walk back and forth. Tell the patient to walk towards you and away from you. And, okay, so can you walk back and forth? So for scoliosis, yes, as you can see, what you have to take into consideration is mainly shoulder tilt and pelvic tilt. Keep that in mind. Next, you want to expose the patient adequately. You want to inspect for the back. So what can you inspect? Inspect for deformity. That's the first thing you want to. The patient's complaint itself will be in relation to some lateral curvature of the spine. So you want to mainly look at some convexity, some lateral curvature at the spine, which comes under deformity. The other deformities that you want to look at is, of course, pelvic tilt, shoulder tilt, etc. Excessive kyphosis, lordosis, mention all these things in relation to the normal spine anatomy. And also you want to look for infective signs like swelling, erythema, sinus discharge, etc. You want to also think of a central cause. So look for cafe aureus spots because neurofibromatosis is of a concern. And also you want to look for abnormal hair distribution. So you want to think of spina bifida where you will get a tuft of hair. But remember, most of such cases would have been intervened with a surgery. So what you will actually inspect is a scar. So don't forget scars as well and skin changes related to it. So once you inspect, now you're done with it, look, feel. Palpation, there's superficial and deep. Superficial, just like how we do for lumbar spine examination, check for warmth, increased warmth. Okay, just check. Okay, and then check for soft tissue. So whenever you palpate soft tissue, use your 4 fingers. If it's bony palpation, you use your thumb. So this is central spine. Use your fingers to palpate the paraspinal muscles. Okay, paraspinal muscles. To look for any tenderness, because it could be, the back pain could be due to muscle spasm. Okay. So paraspinal tenderness. Then when you go to the bony landmark, you want to estimate the level of curvature. So wherever you see the curvature of the spine, you want to know at what level the convexity actually starts. So you want to take 2 landmarks. What landmarks are you going to use? Flex the neck. So you are going to look at the hump, the prominence of C7. Okay, C7 is an atypical vertebrae with a very long spinous process. So this prominence you see here is C7. This is one landmark. The other landmark is, as we can see, the inferior angle of the muscular, very hard to put. Okay, the inferior angle of the scapula. That corresponds to T7. Okay. So accordingly, you palpate for the spinous process. Okay, you palpate. Okay, so this corresponds to T7. So wherever the curvature is, just go. So if this is T7, the spinous process below will be T8, T9, etc. And the level for L4, L5 is the iliac crest. So palpate for the iliac crest and see where the thumb meets. This is L4, L5. So L4, L5 at iliac crest, the highest point of the iliac crest. Inferior angle of the scapula is T7 and the spinous prominence here is C7. So accordingly, use those landmarks, palpate at each spine, each bony prominence which you feel is one spinous process below it. Accordingly, move along and wherever you find the curvature starting, that's your estimated level of deformity or curvature or convexity. So that's how you estimate and also see if there's any bony tenderness there. So movements, what are the movements that you know?
So we have flexion.
Flexion, ask the patient to bend and touch the toes with the fingers. Okay. Okay. Then extension, you might want to stabilize the patient, hold and see. Okay. Then lateral flexion. Yes. Always showmanship is important. Be with the patient. Lateral flexion and rotation. Okay. So what's the significance of movement in scoliosis?
So meaning if the patient have deformity towards the right or towards the left, that specific lateral flexion will be restricted. Let's say right or left, the left-sided flexion will be restricted.
So let's say the scoliosis, there's a convexity. Convexity means literally curvature. Okay. So let's say this is right side, this is left side. Let's say the convexity is towards the right. So lateral flexion will be restricted over
right side.
Right lateral flexion will be restricted, right? Let's say the convexity is towards the left.
Careful.
Okay, so left side, then
the left-sided lateral
flexion will be restricted. Okay. Now special tests. So what are the special tests that you know which is important for scoliosis?
So the most important thing based on what we learned is the Adams forward bending test. Second one would be scoliometer, assessing the curvature with the scoliometer, and plumb lines. And the others are, I think, like what you said, is PG level. So we just concentrate on these three.
And finally, you want to also ideally do a neurological examination, time permits, or at least mention it verbally.
Okay.
So what do you want to start with?
So I would first, for the Adams forward bending test, we would want the patient with a deformity to first, if you have to always show them. So before we start, we have to show them, because you cannot verbally tell a patient, because they are not usually the
show me enough.
Yeah.
You have to show me, right?
Yes, correct. The patients are not that educated to understand or comprehend. So you just have to like makcik buat macam ni boleh? Sakit. Okay. So this is a time where you go behind them and you keep your eye perpendicular to the spine. So this is where you can assess whether the convexity is towards the right or towards the left. How do you do that? You see if there's any hump on either side. So with this, you can deduce that the curvature, if suppose the hump is on the right side, the convexity is towards the right, and suppose the convexity is towards the left, then you can deduce that the convexity is towards the left. And one important thing to keep in mind is, whenever the convexity, the deformity, or the curvature is towards the left, that calls for an MRI. This is just it's what we call a Dinsley's point for you to mention.
This is right, this is left. So what do we mean by convexity to the right?
So
it means it moves like this.
Correct.
Convexity to the left means it moves like this. Right? Okay. So this is right convexity, this is left convexity. Special test we have done with the Adams forward bending test. So have you heard about a scoliometer?
Yes, a goniometer. It's used to measure the flexion of the hip and knee.
It's goniometer, which you extensively use. So let's say you get a case of scoliosis, you must use this scoliometer.
Oh, scoliometer. Okay.
So you wouldn't probably purchase it. No great indication for that. Might be even difficult to get in hospital. So I took the hassle to just buy this so that we could video this.
Wow. Thank you, sir. Thank you.
Thank you. No audience also. So it's very similar to what
like
we
the
use.
constructions.
Exactly. Yes, I said. Okay.
Yes.
So can you try using it? So you know you have been in constructions.
So I think the idea is for the ball bearing to be in the middle, because this shows the degree of this show how let's say the curvature, like what you say, how much it has moved to the right or to the left. So I think the idea is for us to detect whether it detect the angle, detect the degrees of how much it has
curved. So if it's in normal position, it should be at 0.
Yes, right.
Okay, correct. So how will you do it?
So I think like what I said, the patient has to be has to remain in the Adams forward bending position.
Okay.
So
okay.
Yes. So from there, as we have gotten the idea of where the hump is, that like I explained previously, if the hump is supposed on the right, so then the right sided is where the convexity is. So we just simply place the scoliometer on the hump. So as to I'm just example. Okay, there's a hump here, and I'm placing it on here, and we can see about 5 degrees of convexity towards the right. So this is the right side, this is the left side. Okay, yeah. So I think we have just like pretended that there's a very there's a hump. So we can detect that there's a 10-degree convexity towards the right. Thank you, sir.
Okay.
So with this, we've gotten a clue that the curvature of the spine, the deformity of the spine, is towards the right with a 20-degree angle. I don't know how to put it. Is that right,
Yes.
sir?
Yes. So that's very simple.
Okay.
And I bought another instrument. So what structure is this? It's a,
So plumb line, sir.
I mean, what shape is it?
I think what intention?
Triangle. Okay.
It's a cone, something like a cone.
Triangle with an.
Oh, okay, sir.
So I mean, it's a plumb line.
Yes, it's a plumb line.
Plumb bob.
Plumb bob.
So,
yeah.
So you did use it in construction as well. So what did you use this for?
I think it's to check how straight the building is or something. I'm not mistaken.
I know I'm straight. What about you?
No, that's
Okay.
I'm also straight. Okay, so for this, I think we have to first, like what we palpated initially, we have to locate the C7 spine protuberance. As like doctor explained previously, if you really want the exact anatomical landmark, you can rewind previously for him to locate the exact point. So I'm just gonna give you a rough idea. So you just put the start of the plumb line here, and then you simply look at the gluteal cleft. So suppose the curvature is towards the right or the left, the plumb blob or the plumb line will indicate that the curvature is towards the right, towards the left. This is so simple. So for a normal human being, for a normal person without any pathology, the plumb blob or bob or line, I'm not so sure of the pronunciation, it will align itself exactly at the gluteal cleft.
An easier word for gluteal cleft.
It's a butt cheek, isn't it? Yeah, butt cheek. Sorry for being derogatory. It's
Yes.
colloquial. It's a colloquial term. So the plumb blob or bob or whatever it is, it will align itself exactly at the butt cheek or the gluteal cleft. So you don't have to exactly explain on, okay, it has moved to this side, it has moved to this side. You just say that, okay, the plumb blob or bob is indicating that the curvature is towards the right, towards the left. That's the idea of the whole examination. Because anything more than that, I think it's...
Yeah, do you know that's a curvature?
Yeah.
Just keep it simple.
Just keep it, exactly.
Hold it, literally you see it's on a straight line.
Because the whole idea of scoliosis is about PG.
Okay, and I said yes, as I said, other theory related, it's more to postgraduate.
Yeah, and
this is what you need to know for.
To get a rough idea, like what you said, sir, there's something you can go and read about the tennis staging and also the riser sign in pelvic X-ray. So that things correspond to the scoliosis.
The prognosis,
Yes,
the
and everything.
progression,
So you can just
management, etc. So those are a lot of reading stuff that you have to do.
So the main thing is this one.
The examination sake, this is okay. We'll do.
So thank you, sir, for the scoliometer. Can I have it, sir?
No, the frame put it.